So here is an overview of our talk this evening. I'm going to start us off by talking about what is medical traumatic stress. And then I'm going to pass it to Dr. Simpson, who's going to talk more about what we can actually do about medical traumatic stress. And then we're going to have a lot of time at the end to answer your questions. And as Judy mentioned, we received a lot of excellent questions ahead of time, and we really, really appreciate all of those questions. And I think this is a topic that we could probably talk about for several hours, but we only have 1 hour tonight. So we're going to do our best to answer those questions, but we might not get to all of them. And one more note is that Dr. Simpson and I created this talk to be directed towards children and adults with spina bifida and their caregivers and families. But we certainly think that this is going to be relevant for different folks as well, like including medical providers. So we hope that this is a useful webinar for you. So let's start off by talking about what is trauma. When someone feels intensely threatened by an event that they are either involved in or that they witness, we call that event a trauma. And there are a range of things that could be considered a traumatic event. So it could be something like community violence, it could be a natural disaster, it could be the death of a loved one or experiencing grief. It could be domestic violence, interpersonal violence, abuse, war, other types of conflicts. It could be experiencing discrimination, bullying, or family separation. And of course, it could be about medical interactions. And so tonight we are focusing on medical traumatic events. So what could be a medical traumatic event? There's really a variety of things that could potentially be traumatic. So this could be something like experiencing a significant amount of pain, experiencing an injury, experiencing a serious illness in general. It could be when you receive a new diagnosis or when you learn a prognosis that's maybe not so great. It could be going through a surgery or a procedure. It could be having medical testing or invasive medical treatments. Or it could even be like a really difficult medical interaction. So there's really a variety of things that could potentially be a medical traumatic event. And so a medical traumatic event is what happened. Medical traumatic stress is the negative psychological and physical responses that someone might go through after experiencing that medical event. And there are 3 ways that you may experience medical traumatic stress, in that you may be the person that experienced the traumatic event itself. It could have happened to you, or you could have witnessed this traumatic event happening to somebody else. You could have seen it. Or maybe even you learned about a traumatic event that happened to a very close family member or friend. So the key here is that you can experience medical traumatic stress even if it didn't actually happen to you directly. And so what exactly is medical traumatic stress? Well, we tend to think about traumatic stress symptoms as falling into these 4 buckets. And I'm going to talk us through these 4 buckets. But what I really want you to remember is that traumatic stress varies for everyone. There are no 2 people who are going to experience traumatic stress in the same way. It could look very different for everyone. So the first bucket I'm going to talk about is something that we call re-experiencing symptoms. So this is if someone is having memories or dreams or flashbacks of the traumatic event. So an example quote of a thought someone may have who's having re-experiencing symptoms would be something like, quote, "It pops into my head and it feels like it's happening again." The next bucket of medical traumatic stress symptoms that someone could experience is what we call avoidance symptoms. So this would be trying to avoid thinking about the medical event, avoiding places that remind you of it, avoiding people that remind you of it. So it could be, avoiding going back to the doctor, to the hospital. It could even be like, I'm going to avoid that person because I know they're going to ask me about this traumatic event that happened. So an example quote that could demonstrate avoidance would be if someone said, quote, "I block it out. I try not to think about it," or "I try to stay away from the things that remind me of it." The third bucket of traumatic stress symptoms is something that we call increased arousal. So this could be if you're feeling irritable, maybe you start acting kind of recklessly, you're hypervigilant, which means you're kind of on edge or you're just kind of waiting for something bad to happen. It could be that it's really hard for you to focus or you're sleeping really poorly. So an example quote here would be something like, I'm always afraid something bad will happen, or I can't concentrate, I can't sleep, I'm jumpy. And then the last bucket of traumatic stress symptoms is what we call like negative mood or negative thoughts. And this could be feeling really anxious, feeling depressed, feeling kind of detached from yourself or other people, having what we call distorted thoughts. So, kind of thinking things that really aren't real or aren't realistic, and dissociation. And so, dissociation can mean kind of similar to detachment, like feeling detached from yourself or other people, or kind of feeling like things aren't real or you're not really like living your life in your own body. And so some example quotes from this could be like, I feel hopeless. No one can be trusted, or it felt unreal, like I was dreaming. And I'm just kind of giving like an overview of all of the traumatic stress symptoms that someone can experience. There's actually kind of more detailed examples beyond this, but again, I just want everyone to remember that's what really important is that everyone experiences these things differently. And another really key thing to remember about medical traumatic stress is that it's related to somebody's subjective experience of what happened, of that medical event. In other words, it's related to their perception of the medical event. And so, maybe to one person, having a blood draw is no big deal. Maybe to another person, it's a very big deal and it was a very traumatic experience for them. And so that's the key piece here is that this is individualized. It's about one person's experience of it. And I think this is especially important when we think about kids who go through medical traumatic events, because oftentimes a child can experience something as much more intense and traumatic compared to what maybe an adult may view it. And these two pictures I have up here is just to kind of to exemplify how someone can see an animal approaching them, and maybe one person would view this animal as a cute little kitten and another person sees this animal as an aggressive tiger. Perception matters. So a question that I hear a lot is, how is medical traumatic stress different from stress in general? Someone who's kind of having what we would say is stress might say something like this. They might say to themselves, quote, I have another long clinic appointment today. There will be so many exams and many people are asking me questions. I'm exhausted just thinking about it. Now, someone who's experiencing medical traumatic stress may be thinking to themselves something more like this. They may say, I'm so nervous about my appointment today that I feel sick. The last time I went to the hospital, I was admitted to the ICU. I felt so much pain. I thought I was going to die. I don't know if I can go today. So there are many aspects of disease and illness and medical procedures that are stressful, absolutely, because they're painful, because they interfere with our life. But the difference with medical traumatic stress is that it really affects and seriously impairs everyday function. It gets in the way of living everyday life. So, why is it that going through some kind of medical event can do this to us? How is it that it can cause us to experience this traumatic stress? Well, a few things. When we go through a serious medical event, again, we're talking about anything from a surgery or receiving a diagnosis or going or having a ongoing but really invasive treatment or rehab. These events can challenge our beliefs about the world being a safe place. It can make us feel like the world's not safe, and it can remind us of how vulnerable we are. And then often in the medical environments, there's a lot of like high tech, intense medical treatment that can just be really frightening and intimidating no matter what your age is. It can make someone feel really helpless. Sometimes the medical environment in general and the interactions between patients and doctors can make patients sometimes feel like they have less power in those situations. Also, there's often just a lot of uncertainty about, how's this surgery going to go? Is it going to work? What's going to happen? Often pain is involved in many things that happen in the medical environment. And then lastly, oftentimes there's really important decisions that have to be made. And it's sometimes it can be really difficult. Do I do this? Do I do that? What are the consequences of it? Am I going to feel regret? So there's a lot of that also that characterizes medical events and can cause them to be traumatic. There's other important aspects or kind of characteristics of medical events that can determine whether this is something that causes traumatic stress for someone or not. So things like, did this medical event happen suddenly or gradually? Was this something that, all of a sudden it just happened and surprised everybody, or was this kind of unfolding slowly over time? How intense was this medical event and how long did it last? Were there ongoing complications afterwards? So, was somebody hospitalized for a very long time, but then even after the hospitalization was over, then they had to participate in kind of long-term, treatment or recovery efforts that just kind of added to or exacerbated the trauma of the hospitalization, for example. Were other family members directly affected by this medical traumatic event? And are the health effects obvious or visible to others? Sometimes when they are, that can exacerbate the trauma one feels, whether it's because people draw attention to it or people ask about it more, or the individual themselves might be reminded of it more. So again, these are all things that can kind of determine how a medical event can lead to causing traumatic stress or not. So, can medical traumatic stress be diagnosed? The answer is yes. So, a medical or mental health provider can evaluate and diagnose medical traumatic stress, and it would be considered kind of one of two different diagnoses. But to meet criteria for a diagnosis, you have to have multiple symptoms of those buckets that I was describing earlier, those like four buckets where you might be re-experiencing the traumatic event, you're avoiding it, you have increased arousal, you're experiencing negative mood and thoughts, you're having some dissociation maybe. We as in mental health providers have very specific criteria, but you have to experience a range of those symptoms and it has to cause significant impairment in your life. And if that's the case, then you might meet criteria for one of two diagnoses. If your symptoms have been occurring like between 2 days and 4 weeks from the medical traumatic event or in general, we would say that's called acute stress disorder. But once those symptoms persist beyond a month, then we call that post-traumatic stress disorder. So how common is this, right? Everybody receives medical care. How common is medical traumatic stress? Well, there's not a lot of great data on this in general among all people, not just individuals with spina bifida. So in general, one study found that between 3% and 27% of adults will meet criteria for PTSD related to any trauma, not just medical trauma, at some point in their life. So that means like anywhere from 1 in 30 to 1 in 4 adults will meet criteria at some point for PTSD. Again, it's not clear what percentage of that is medical trauma, but that, to me, I think that's a pretty high number. Another study that was focused on kids around the age of 10, right after they had surgery, it found that these kids were meeting criteria for a range of mental health disorders. So 13% met criteria for PTSD, another 18% almost met criteria for PTSD, 6% met criteria for depression, 8% met criteria for anxiety, and about 16% met criteria for what we call disruptive behavior disorder, which is kind of like oppositional behaviors. So after kids went through surgery, a good amount of them were experiencing some negative psychological and behavioral consequences from that. And then lastly, there's another study that found that when parents experience medical traumatic stress, that can predict their child's symptoms over the next year. So really just kind of highlighting, which we know in general that, parents' well-being does impact the well-being of their children, but this study confirmed that it's the case with medical traumatic stress as well. So what about for people with spina bifida? What is the research on medical traumatic stress in the spina bifida community? Well, there's very limited research, unfortunately. We definitely need more research in kids and adults to understand, who is experiencing medical traumatic stress, and why. We definitely need more research. So on average, people with spina bifida go through about 5 surgical procedures from birth to adulthood, and 88% of surgeries have occurred by the age of 18. And this could be a variety of surgeries. So the most frequent ones are neurological, so typically kind of related to shunts, but many individuals with spina bifida could have orthopedic surgeries, urological, gastrointestinal, or related to skin. So, like I said, there is very limited to no research on medical traumatic stress within the spina bifida community. However, there was this one study that looked at parents of kids with spina bifida, both kids who were newborns and then kids who were school age, which is about 5 to 11 years old. And what this study found was that of all these parents, about 75% of them experienced medical traumatic stress when they first learned about their child's diagnosis. And in most cases, it took about, within 4 years, that medical traumatic stress had kind of gone away. But there was a percentage of parents where it didn't go away. So about 30% of mothers and 20% of fathers were still experiencing some ongoing medical traumatic stress, even when their child was, school age, between the ages of 5 to 11. And that doesn't imply that the traumatic stress was from the diagnosis. It just highlights that there's a good percentage of parents who experience medical traumatic stress while they are going through the kind of journey of medical care for their child. Okay, so who exactly is at risk for experiencing medical traumatic stress? Well, here on this slide, I have a list of quite a few things that could put someone at stress. If one of these bullet points describes you, that doesn't mean you definitely will experience medical traumatic stress. But from what we do know in the research that does exist, we have found that these are factors that might make it more likely for someone to experience medical traumatic stress. So if you have had a prior post-traumatic stress experience, that's going to make it more likely that you experience traumatic stress in the future. If you have an existing mental or behavioral health condition like an anxiety disorder or depression disorder, that will also put you at risk. Other things like if you have intense fear before, during, or after the medical event, or if you experience a high level of pain during or after a medical event, these could increase your risks. If you are someone who doesn't really have a lot of coping strategies in general for managing stress, this is something that also can put you at risk. And then other factors include if you're someone who is isolated socially, meaning maybe you don't have a lot of family and friends in your life that support you, or if you're younger, if you're a woman, if you're of low income, if you have a physical disability or an intellectual disability. These are all factors that might put you at greater risk of experiencing medical traumatic stress. And lastly, the research has kind of found that for those who might be considered part of a socially disadvantaged group or background in general, you might be more likely to experience medical traumatic stress. So this could be something like being part of a minoritized group because of race and ethnicity, or because of like sexual orientation. The research is a little bit mixed on that. But so you could see here, there are a variety of things that could potentially put somebody at risk.
The place to start is what can we do to try to prevent medical traumatic stress to begin with? And I think, one of the biggest areas of prevention, I also kind of see it as, intervention, it begins with our medical providers. So really asking your medical providers about how they can help you. Now, this depends and varies based on the healthcare system that you attend and you belong to. But the healthcare system may even have a defined protocol of how they are assessing for traumatic stress in children and or adults, and certainly how they can help intervene and treat these symptoms when they see that come up for you as their patient or for a parent of a patient. So some of these protocols include systematic screenings. So actually either having a questionnaire that a child, adolescent, or an adult fills out, or having a questionnaire that a parent fills out. It can also just include having the physician or a social worker or perhaps a psychologist in clinic meet with you as the patient, meet with you as the family to proactively assess for some symptoms that could be already present, or some of these distress factors that could be there before a medical event may be coming up. What you're seeing here, this DEF protocol, is a protocol that is available on the National Child Traumatic Stress Network website. And we do give you links at the end of this presentation for that website specifically, because they have tons of really great resources for parents of children, for providers. It's a really great resource to have. But this is a protocol that was designed to really help assist providers proactively address stressful symptoms that can occur in the medical setting. But not only is this helpful for providers, I think it's also very helpful for parents and even children and adults, because it addresses three main components that we find very important when intervening with medical traumatic stress symptoms. So this first area, distress, I think this is a huge one that comes up for a lot of the families that we work with, where there's a big need when anyone hears about having to have a medical procedure, whatever that medical procedure is. There's a lot of thoughts and feelings that can come along with that immediately. And like Dr. Papadakis had just mentioned, those thoughts and feelings and reactions to hearing about a medical procedure or a surgery that you might have to have vary for every individual. But what we do know that can really help in reducing that distress is information. I've had the opportunity to work with and talk with a number of young adults who have gone through many procedures in their life. And one of the things I hear most often is that they did not have enough information going into a surgery or a procedure. They really didn't know what to expect. They had no idea what was going to happen from the moment they got there to as the procedure was taking place. And many of them recall that procedure being incredibly scary, because if they were getting information, that information was being provided to them in the moment when things were happening, and it just didn't give them time to process what they were hearing and to really feel like they had good understanding of what was going on. So I think making sure that providers are providing this information, but also that you as the patient, you as the parent, feel confident in asking for the information. And really making sure things aren't moving forward until you have the information. So that's one very important part. Then this next piece, emotional support. So for children, really encouraging parents to be with their child as much as possible. And usually this is not something parents are refusing. They want to be with their child. But sometimes in various circumstances, children can be separated from parents, or parents may not be able to be in the room the whole time. We know with certain exams or certainly surgical interventions, parents can't be there the whole time. But as much as possible, having parents or a loved one, a partner, someone who feels supportive to you, to be there to help comfort you and help you through that experience. Family is another huge component when we are looking at assessing and treating children and families, individuals with medical traumatic stress. Gauging a family's level of distress and other life stressors happening for a family have a very big impact on how a child or an individual may cope with a procedure or a medical event. And if there are things that we as providers or other resources in the community can do to help alleviate some family distress that they're experiencing, or provide additional resources, that we definitely want to be able to do that proactively to help assist in reducing these stress symptoms. Another more specific intervention that can be really helpful for children and for adults in, kind of shaping this in a little different way for adults, but oftentimes creating what we would call a social story or really like a plan of action that can help you think through what happened. So this would be something that you could do following a medical event that was perceived by the child or the individual as traumatic, kind of walking through a story of what took place. And not only defining what happened, so those more objective experiences of what happened, but the feelings associated with what the individual experienced or the child experienced. And by walking through the story, you're actually, it's a way of challenging that avoidance that Dr. Papadakis had just talked about. You know, avoidance is one thing we really try to do when we have a traumatic experience. We don't want to talk about it. We don't want to revisit it. We want to just avoid, and that doesn't actually help us in the long run. Avoidance is the opposite of what's going to help, but by creating a story such as this, and even just being able to talk to someone about your thoughts and your feelings and what you experienced, that in and of itself can help alleviate some of these post-traumatic stress symptoms you can experience or your child can experience. And then it's always good after you kind of talk through a story like this to also really identify, you know, what makes me feel better in these moments when I'm thinking and feeling, when I'm having thoughts and I'm sitting with these feelings related to this event. What can I do to help myself feel better? This is another example. And again, a lot of these resources you can find on the National Child Traumatic Stress Network website. But another good intervention or a resource to help either your child or yourself cope and adjust following medical trauma can be to really try to set some goals. So one of the things that post-traumatic stress symptoms do, like I just mentioned, is they make us typically withdraw from others. They make us, those symptoms kind of make it so we don't want to be around maybe our loved ones or friends or other people as much as we used to. They make us avoid places or things that might potentially remind us of this traumatic event and so forth. But by doing those things, it really only makes the symptoms worse, not better. Starting with identifying a goal. So thinking about the things that used to really, you know, bring you pleasure and things that you used to enjoy doing, you know, so for a child, it might be getting back to school and seeing my friends again. For an adult, it could be, you know, I miss going out to dinner with my friends, or I really want to go see a movie. I haven't seen a movie in a really long time. That used to make me feel very happy, but I don't want to do that now because of these post-traumatic stress symptoms I have. So kind of setting this goal and then working backwards from there. So you have your large goal, but then you really want to kind of create these small steps that help you get there. And some of those steps certainly can be asking for help. And that can be asking for help, again, from family, from a parent, from loved ones, from a partner. It could be asking for professional help. It could be reaching out to your primary care doctor, or for a parent, kind of contacting a pediatrician to ask for a list of resources for mental health providers. Asking for help could be the first step, then making a plan. And certainly another step could be what we just discussed, is talking about what you experienced, creating that social story, not avoiding the thoughts and feelings you have, but really trying to kind of put those thoughts and feelings down and acknowledging them. And then slowly you work your way to meeting that goal, and really with the overarching kind of goal of trying to get back to those things that you enjoy, getting back to your life. So this slide specifically focuses on parents and how parents can help their kids. So we really want, as parents, to encourage your child to talk about the medical event and their reactions to it. Oftentimes parents ask us as providers, like, should I bring it up? It's something that feels so upsetting to them. And honestly, it's something that feels so upsetting to the parent. It can be hard to want to bring it up. But we know from research, and we know from experience that encouraging your child to talk about what happened is important and helpful. And it's a balance, you know, it's not kind of pushing but it's just encouraging and then waiting and listening, answering your child's questions honestly, and listening for those unspoken worries or fears. And it's okay as a parent to say, you know, I don't know the answer to that, but I hear what you're saying, and it seems like this feels scary to you. So trying to really reflect and validate the feelings that you're hearing, and that it's okay to not have the answers, because you're not going to. Support your child in participating in normal activities, school, friends, as much as possible. And, you know, this goes for adolescents and young adults too. We want to get back to those activities, even if we don't feel ready totally, because those activities help us see that, help us feel safe, help us feel normal, you know, those normal experiences, and help us kind of get us out of that trauma mind frame, that kind of feeling so stuck. So supporting your child and getting back to those typical activities. Certainly getting professional help if you're concerned about your child. And one of the biggest pieces is also, you know, if you notice as a parent that talking about your child's medical trauma brings up distress for you or causes up, you know, upset emotions, it's incredibly important for you to be able to find to ask for help and seek support, because the more parents can get the help they need, and the more parents feel like they can work, or that they have addressed their own feelings related to the trauma, the more readily available they're going to be to help their kids. And I know this is a tough one, because parents, they put their kids first all the time. And that's what good parents do. But in so many circumstances, when it comes to your child's mental health and your child's well-being, parents have to take care of themselves first to be able to help their kids the best way they can. So I hope that message is heard, that it's important for parents to seek support as well, and for providers to be able to help find support for parents. Another helpful, I'm not going to go through each one of these points because I definitely want to save time for questions, but this is another really helpful document that can be found in the National Child Traumatic Stress Network that really walks through steps to help your child after they've experienced a trauma. Many of these things we've discussed, but please check out this resource if you find it helpful. And another important intervention that we wanted to highlight today, and this is an intervention that's been studied on the full lifespan of ages, so not just for children and adolescents, but for adults as well, is something called trauma-focused cognitive behavioral therapy. And this is a therapy that is it has very specific components that have been proven to be effective in reducing post-traumatic stress symptoms after a trauma. And these are some strategies such as learning relaxation techniques. Relaxation techniques are incredibly important for reducing that physiological response we have in our body when we experience trauma. So things like your heart racing, or that muscle tension you can experience, or stomach upset. All of these relaxation strategies can really help reduce those physiological symptoms. Building awareness of the way we think about the trauma, and oftentimes trying to restructure the way we think to be more helpful. Sometimes when we experience trauma, we can get stuck on thoughts that really don't help us. They may be valid, they may be accurate, but even if they are, they're not helping us move forward. And so this therapy, this treatment intervention helps us look at our thoughts, and if needed, trying to kind of restructure those thoughts to be more helpful and encouraging. Part of this treatment is also creating something that's called a trauma narrative, which is telling our story, being able to talk about our story, and even outlining it through writing is, like I mentioned, is a form of exposure work. It's facing that fear instead of avoiding it. And over time, the more we face the fear, the more we are able to talk about what's happened to us, the less powerful those experiences become. And lastly, learning how family members can continue to be supportive as you're working through the trauma you've experienced. Okay, so these were some of those links that I had just mentioned. Many of them are to the Child Traumatic Stress Network. This last one here is actually to the TFCBT network, or TFCBT website. And on this website, I do want to let everyone know it's a national website where it does have a link that where you can search for providers that are certified in TFCBT in your state and region. So it doesn't necessarily mean that those providers are in network from an insurance standpoint. So I'm not guaranteeing that, unfortunately. But it's definitely a good place to start when if you're looking for an evidence-based treatment. Also, another excellent place to start is just asking, whether it's your pediatrician, whether it's your primary care doc, or the medical setting that you seek your care, asking them for resources for mental health support is a great place to start.